Hey guys, welcome back to another episode. Today, obviously, we're going to go through some things and some new updates with the coronavirus. This is our bi-weekly visit, and then from this,
Yes.
I think we're going to go weekly. So, when I say we're at our visit, I mean she's at our visit because I still can't go in. So, what we'll do is we are going to just let you know what they said. We're going to FaceTime while we're in there. Obviously, you won't be able to see the appointment, but what we will do is we'll give you a recap on what they said, what to expect as a result of this coronavirus. And we will see you guys in just a short second after her appointment. All right, guys. So we just finished, or she just finished her appointment. So how'd it go?
It went well. It was just really quick, in and out with my N95 mask.
And I was on FaceTime.
Yeah, so we had our family on FaceTime. That part was really cool. So my face is a little red because of the mask, but yeah, so we have 5 more weeks left. We're gonna go weekly moving forward. But it's definitely a different vibe going into the doctor's office. So it's much more efficient because we're seeing people one at a time, that's a perk. But yeah, the heartbeat was pretty strong and healthy, and so that's the good news.
So right now we, in terms of delivery, it's still the same, meaning one person in, one person out. You can't have somebody in for for moral support and then the next person come in for labor and then the next person come to visit. You can't one person in, one person out, one person in, one person out. We only one person the whole time. From what I heard, it was kind of hard for me to hear because I'm on FaceTime during this appointment. But I think she said something else about that, right?
Right. So the self-quarantine, I asked, since my parents have been pretty much on self-quarantine for the past month, would they be able to visit the baby? So that's based on our discretion. But if they're not presenting with any symptoms, then they're good to go. They can wear a mask and such. But if you are traveling, we asked about that too. So the risk is higher, obviously, if you're flying, but if you're driving, definitely wherever your destination is, you want to quarantine for 2 weeks before.
So that means if our family wanted to come, they would have to come here, spend 2 weeks in isolation by themselves, and then they can potentially see the baby. And right now, it looks like it's up to our discretion if we want them to see the baby, right? So it's not like we need to wait 4 weeks or 3 weeks or 2 weeks for the immunity for the baby.
Right, and she did mention that it's a low risk for the baby. But just practice, caution. If you notice your family members are sick or even mild symptoms, it's just best to err on the side of caution. But if someone's been quarantining for several weeks and they're not presenting with any symptoms, perhaps it's a-okay. But again, with the proper, washing your hands, being mindful of if you're coughing for whatever reason.
So they will be able to see the baby.
Putting a mask on and things like that. So.
But they have to wear a mask for the baby.
They don't have to, especially if they're not presenting with any symptoms. But
it's probably advised right now, I would assume.
If you're a little too close, at least for the first couple of days, a week or so. Anyway, it really is based on your own personal discretion. You know your family members more than anyone else. So, you know where they've been, what their pattern and their routines were like. So in my case, my parents haven't left the house. So it's a bit of a different situation, but it's based on your comfort level. So listen to your gut feelings, your intuition, and go with that. Babies are born and they're very vulnerable and they're fragile, so you want to just be extra cautious and careful. So that's it. It was a pretty neat experience. We love our doctor. She's really good.
I don't think there was any other things that we had to do or say regarding birth and COVID. I think that was it for this week. So it's really not much of a difference. I have a feeling that it's not going to change week to week. But, yeah, I just don't think it's going to change week to week. I think it's going to be, if you have to have somebody, you're going to have to quarantine and be smart, because this virus, this illness, this disease, whatever you want to call it, it's not going away. And it's not going away anytime soon. And even if a vaccine came out today, it's not going to be, everybody would have to get shots, and everybody would have to build immunity, and then things would start to normalize a little bit. So it'd still even take some time. So I know that's a little bit different topic, but I guess for baby's sake, everybody's got different opinions. Everybody's got different thought processes. So, I don't know. Anything else you want to talk about, add?
I think that's all we got for this week. We'll see you next week, week 36, and we'll keep you posted on updates. I'm sure by then we'll have more information, hopefully from CDC, some more guidance as to how to proceed with things. But we get updates very frequently, so that's
the newest rule is essentially we got to have masks 24/7 in anywhere public. So, that's unique. And right now, not that I'm here to give you, or we're here to give you updates on what the CDC is saying. We're here to give you updates on what our experience is based off of the demands and the things that are happening on a governmental and health related issue with regard to birth. So, it's going to be a little unique, and we'll see what happens. We don't really have a choice. Nobody does. We're just going to choose to live the best we can and be smart. So that's it, guys. Hopefully you enjoyed this week. And if you have any questions, like always, please reach out to us. Leave a comment below. Let us know what you're going through, what you've experienced, if you've already experienced this stuff. If you are a few weeks behind us, like we're 35 weeks, so if you're a few weeks behind us, let us know what your experience is, or if you have any questions, because some people have a lot more questions. And I've been asked by some colleagues and patients, and so we'll see. We'll do the best we can. All right, guys, we'll see you next time. And like I said, take care.
Be safe.
Be safe.